Ian's path threatened many of Florida's medical facilities. At least 9 hospitals, a dozen nursing homes had to evacuate or transfer patients after losing power, access to clean water. One hospital's roof ripped off. And with areas around Southwest Florida leveled and roads destroyed in so many places, many more people are in need of medical attention. Florida Hospital Association CEO Mary Mayhew joins us live. Thank you so much for giving us some of your time. This is day 2 now after the hit. What are you seeing as far as the biggest impact on facilities at this point?
Well, we are fortunate that hospitals for years have been hardening their facilities to withstand a hurricane. We are grateful that many of the hospitals in the hardest hit areas did not sustain physical damage. Obviously, there was one in particular that did sustain pretty significant damage to their roof. The biggest challenge right now is the disruption in the public water supply in Lee County. That is affecting 3 hospitals with roughly over 1,000 patients. There are efforts underway to evacuate some of those patients, while at the same time working, Governor DeSantis deployed the Army Corps. They've been working to get the water restored. We absolutely need to have our hospital services functional, not only for the patients they currently have, but for those who may need medical care through these search and rescue operations.
And Mary, we're seeing video, of patients taken out on stretchers, through the rain, through the conditions. What is a large-scale evacuation process like?
It is indescribable. And first, let me just say the outpouring of hospitals around the state and in the Southeast region offering to help. So we have hospitals around Florida that have offered up over 2,000 beds to receive patients that are being evacuated. They are offering ambulances, air transport to help support this. But it is a massive undertaking. And again, it's important to try to minimize and avoid that as much as possible. These hospitals have done everything to support their patients, to work with the city to determine whether water would be restored. But patient safety, patient care is the biggest priority right now.
And Mary, that leads me to my next question. How do you keep patients safe through a process like that? Because, it can be dangerous to take a healthy person from their home and keep them safe. How do you take a patient who may be very sick on top of now having to be evacuated?
Let me just say that the emergency preparedness of Florida's hospitals cannot be overstated. For years, they have been updating their emergency plans. They've been drilling on them. They have sophisticated, trained teams, and they certainly have throughout the state transport teams, skilled medical providers that accompany these patients, that are prepared for these kinds of transports. This is a large-scale effort. It involves not only healthcare professionals locally, but around the state officials in our EMS division that are helping to coordinate and support this effort. A lot of individuals working day and night to support this effort.
Absolutely, and doing such important work. We focus so much on the patients. Obviously, we want to keep them safe. Let's focus on those staffers. How is staffing being impacted?
It's hard to talk about this without acknowledging that for over 2.5 years, our staff, our nurses, our doctors, our emergency room staff have been supporting an emergency response throughout the pandemic. So you start from a position where they have already been enduring so much for so long, but there is an incredible resiliency to our healthcare providers, our health system, and they are working tirelessly. The big challenge, of course, for our healthcare staff in that region, they're dealing with the damage to their own homes, protecting their own families. So a lot of effort in the coming days, weeks, and months to support our healthcare staff, both personally and professionally.
Absolutely. We so do appreciate the work of the healthcare staff. Mary, we thank you so much for giving us a little bit of your time today. Thank you.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.